Um, that's me. I'm, of course, my introduction was given here. A quick disclaimer that, all the data we are trying to use out here is out of experience, but the references that we are sharing are really not for commercial use, but we want to spread more and more awareness about nutrition. And I would, first of all, before I start, like to thank Medvarsity for taking this initiative forward, because nutrition is something where a lot of education really has to be spread not only in our patients or healthy individuals, but also within our healthcare fraternity. And more education and exchange can actually help each of us get better. So quickly, let's understand what long COVID really means here. Long COVID is a physiological condition affecting one or more body systems, where we've seen lung damage, heart damage, including inflammation of the heart muscle, kidney damage, neurological damage, damage to circulatory system resulting in poor blood flow and lingering emotional illness as well, other than the other mental health conditions that have been. So, what is really this? Because these don't sound completely like an infection. All these effects we keep talking about, I'll keep talking about, and I'm going to go over those points. But before that, let's understand what the COVID symptoms have been: tiredness, muscle fatigue, joint pain. We have had damage to multiple organs, including the heart, lung, kidneys, skin, and brain. So we see brain fog in patients where there is difficulty of thinking or concentrating. Again, there is difficulty of breathing, which is known. There is lingering cough, fever, headache is again very common. Dizziness on standing. People have experienced chest pain. Depression, anxiety has been the most common thing again, and of course, loss of taste and smell, which is also seen during and after COVID. So, here is why I really think an integrative approach and a personalized nutrition approach, which helps anywhere else, majorly helps in the COVID condition and the long COVID condition. Pandemic has really proved it to us that nutrition has the power to not only control but cure the diseases and here in the infections as well. COVID has treated every individual differently, and disease, internal organs, and nutrition status, all these are really different and they're very complex. If we see the cell in our body, and you've seen that in our textbooks, the way it's complicated, there are so many organelles there, and the way they interact. Equally, that's why our internal organs, disease, and nutritional status, all of them are complex and different, and they work differently. So we absolutely need a personalized approach, and lifestyle, nutrition habits, digestibility, everything almost varies in every person to person. So what really works for one cannot really work for the other. So here's what we have been doing. Using the integrative, holistic approach, of course, but an integrative approach where the doctor is treating. We do a comprehensive health assessment, integrating that with him, and then taking complete history. In terms of severity, symptoms through the infection, what happened through the hospitalization, which medication was given, more information of what comorbidities were there, if there was any escalation in those, what was the family history around that. All of that really is taken, the complete assessment is done. And then we, of course, do the nutritional assessment as to what people are eating and then what are the micronutrient deficiencies. Not just testing, but also trying to understand that from people as to what are their food intake, routines, habits. All of this matters, not just what we eat, but all of this, our cuisines, lifestyle, the way we eat, what we eat, when we eat matters. So a complete assessment is also done of the mental health mapping, where we help counsel these patients, where we've seen people having signs of confusion, brain fog, stress, and depression. Like I said, is so common, and fear has been the most common. That you will get COVID, that you've got COVID, and that your COVID now is almost gone, yet you have that fear: what is it going to do to me in the long term? So all this gets assessed, and of course vital signs are assessed, and an activity and fitness routine check is also done, because this also is extremely important. Slowly we really need to get back to the activity and the exercise routine. So for prevention, when I'm going to address from prevention to complete recovery, when we talk COVID, really first we need to work on the prevention. And what does it take for prevention? This is something which our grandmama told us, probably, that you should eat right, and then you should make sure that it assimilates right, and then you sleep on time, wake up on time. So having quality sleep, along with that, having the regular, moderate body exercise. We've been talking about this through COVID continuously, but this has to be continued ahead as well. And the mindfulness. So, a lot of cases have been seen where, because of fear as well, because of panic around the disease, a lot has not been done in the right way. So, try to stay mindful, otherwise, also, so infections will not touch you, because once you don't have stress, if you have too much of stress, that gives rise to more inflammation in the body. And inflammation, which I will come to next now, of course, has been a major cause of the COVID severity, as well as the long COVID. So we see that if all these four aspects are taken care of, immunity can be well managed. I would not call it immunity boosting. It's more of building our immunocompetence. And so these are again signs. Quickly I'll go over that. We all know that balanced diet is talked about so much. Stay active, drink enough water. We all keep talking about all these things. So these, from a prevention standpoint, doing meditation, yoga, having good relationships, healthy ones, vaccinations. We all know about this. But what when it really strikes us? When COVID has struck us, then what? So we have to keep working at a balanced nutrition. I'm sure a lot of talks already have happened on this platform about what's balanced nutrition. It has to be one-fourth whole grains and one-fourth of protein, and vegetables and fruit should be the other half of your plate. You have to have water, healthy oils. We all know about this, but how many of us are really implementing it? So what's extremely important from a nutrition standpoint, like me, is a first counseling the patients to comply with what they need to do. So that's another very important aspect. I'm sure can be a good learning point that we could take home from here today. The other balance of foods which we normally don't talk about is the alkaline and the acidic foods. So we need to understand that while we are trying to beef up proteins most of the times, proteins really fall under the acidic zone. So if you have to keep a balance, you have to eat good number of fruits, nuts, legumes, vegetables, so that there is a balance of alkaline foods as well. So we need to have this. If acidic condition in the body is on the higher side, digestion is going to be incomplete, inflammation is going to go up, and anyways we are going to lead to comorbidities. So to keep secure, these are the preventive measures that we can take. And the more